Hey, good evening, everybody. Hope you can hear me. Kindly confirm.
Yes, audio is good.
Sure. So, welcome to today's webinar. I see the numbers are streaming in. So we are going to just allow 1 or 2 more minutes, actually 2 minutes, and then we can start the program right off. Welcome. Right. Colleagues, members, as you join in, kindly let us know where you are listening in from in the chat box. Name, county, let us know who is in the session with us as we wait to welcome the rest of the team. And of course, remind your colleagues who have not joined yet that we are beginning. We don't want to leave them behind. Yes, thank you so much. Amina from Mombasa, welcome. Samuel Moniki from Nairobi, thank you so much, and karibu sana to this webinar. Michael Okendo from Homa Bay County, welcome. Dr. Diambo from Kisumu, good to see you. Good to see Dr. Tom Kauki from Thika. Nice. Dr. Patrick Mlewa from Nairobi, thank you and welcome. It's good to have you this evening for this session. All right, thank you so much. I think we have some good number. Maybe for the next few minutes, I'd like to just share some background information as we have the rest joining in. Good evening. My name is Dr. Silvanus Manyala. I serve as the Communications Associate at PSK, and I'm excited to moderate this session, which is part of our pre-conference webinar series. We're doing this with support from Livia Health Ltd, and the title Pharmacists on the Digital Health Superhighway, using technology to transform access, care, and practice. And of course, joined in by a speaker who serves as the Chief Informatics Officer for Livia Health, that is Kent Bridgeman, who's also a pharmacist. And we believe that we have the expertise on what it looks like using technology to transform access, care, and pharmaceutical practice. So again, just as a highlight, is that this is part of our webinar series supported by Livia Health. Livia Health are one of our partners for the PSK conference that is happening next month. And we are delighted to have them on board as our title sponsor. Just to, again, just show you how the session would look like. We will have opening remarks in a few from the Livia Health team, the presentation afterwards that goes for about 45 minutes, and then you'll have the opportunity to engage in a Q&A session, a discussion where you can raise questions and get responses. And of course, we'll wrap it up with a few announcements and updates for the membership. But even before I invite the Livia Health team to give us a remark, I just want to highlight that this session is being recorded and it's part of the CPD accredited sessions that we have. Participants will be muted during the entire course of this session. However, during the Q&A session, we'll have an opportunity where some of you will have the privilege to verbally engage, and we will allow you to do that. But even with that, to note, we have the Q&A pod at the bottom of your screen, where you can raise questions progressively during the session, and we'll have them addressed later on. And then, of course, if you have general comments and remarks, or you'd like to just interact with other participants, kindly use the chat section where we are currently engaging. And then, of course, this being a CPD accredited session, we invite you to subscribe for the event on the PPB portal. Remember that we have a 7-day window for subscription and claiming of these tokens. And of course, our criteria for awarding the tokens is minimum of 75% attendance. That's 3/4 of the session. Yes, and just again to lay ground and as a reminder that this is part of the pre-conference webinar series. Our conference is happening on 24th of June to the 26th of June, with arrival being a day before, that's 23rd, and then departure on 27th. And we're doing this in Mombasa, Pride Inn Paradise Hotel, under the theme Pharmacists Leading Transformation and Innovation Towards the Highest Attainable Standards of Health. And of the many outcomes that we expect, it's just keen to note that we'd like to just have the opportunity to leverage digital health and innovation, which is in line with this webinar. So at this point, I want to invite Dr. Saswat, who is the Director of Healthcare Strategy and Analytics at Livia Health, to just share with us briefly about Livia Health, and of course, welcome us to the session. Thank you so much, Dr. Saswat.
Thank you, Sylvanus. Good evening, everybody. Pleasure to be here with everybody. And we are very excited to kick off kind of the pre-conference festivities as we're getting ready for the 46th annual conference with PSK. So since our start in 2016, Livia Health has been focusing on supporting digital transformation of healthcare through technology, partnerships, and a common clinical language. Today, Livia is a premier world-class digital health technology company building infrastructure that's connecting pharmacies, payers, regulators, and health systems. Most importantly, our passion of being around pharmacists today. Our mission is to advance health access through trusted partnerships and digital innovation. And our vision is to become a leading digital health partner in pharmacy management, formulary management, interoperability, and value-based healthcare design. In 2026, this year, we are very proud to continue that journey as we are the title sponsor for the upcoming PSK conference, supporting the future of pharmacy practice and digital health innovation. And with that, I will turn it over to our speaker, Dr. Kent Bridgeman.
Yeah, thank you so much, Dr. Swat. And maybe at this point, just to introduce the substance of the session, I want to invite Kent Bridgeman, who's the Chief Informatics Officer at Livia Health, to share with us. Kent, if you can hear me, I will allow you to share your screen now. Then you proceed. Thank you. Yeah, you are not.
How about now?
Cool. Go ahead.
Yeah, just want to say hi to everyone as he lets me share my screen. Um, just want to say thank you for the opportunity to present on this topic. I'm a pharmacist by training, so really value the profession. Love to see the profession moving forward, any place in the world, everywhere. Anytime I hear a pharmacy winning, a pharmacist doing something awesome, it brings joy to me. So, really glad I can talk about this and how we can leverage technology. To kind of push the profession forward. So really happy that you've given me the opportunity. I'm going to drop off my screen here as I present just to make sure that my connection stays open well. See you maybe at the end. And I'll share my screen here. All right, if I can get a thumbs up, if all right, someone can see my screen. Someone is already on it. I love it. Um, so yep, I'm going to just kind of go through here. Pharmacists on the digital health superhighway, using technology to transform access, care, and practice. Uh, and I'll go through it here. So why this matters, why are we talking about digitization? Why are we talking about the health digital superhighway? You probably heard about it in the news. There's a lot going on in Kenya at the moment, all trying to really move healthcare into a more technology-oriented fashion. You definitely hear about it from SHA transitioning to a digital platform. It's in many news articles there. You hear about electronic medical record systems or HIMS being deployed in thousands of facilities. You probably hear news articles and stories on how the Health Information Exchange is coming and kind of connecting private and public facilities to be able to share that data, with one patient record instead of trying to move that information from facility to facility, a single place where that can be go and retrieve for a patient that they can take it with them. There's definitely a lot going on in the regulatory bodies around this, like PBB. They have a track and trace effort, which is a big push to, be able to take a drug product from manufacturing and track it all the way down to a patient when they get it, to make sure that it's a good product, not fraudulent, stuff like that. There's a lot of news articles out there on thousands of tablets being deployed to the community health workers. So we can see in Kenya there's a big shift to really try to digitize healthcare and really move it forward with technology, try to improve it, improve access, improve care, improve outcomes using this. What's kind of driving this change? A really big push is universal health care. Some of the mandates around that, largely the Digital Health Act of 2023 has a lot of structure put in the government to really try to push this stuff, to get standards out, to really move these things forward. Internet and mobile expansion is happening. Again, there's plenty of news articles out there mentioning how facilities are getting tablets, community health workers are getting tablets, how everyone's kind of getting connected to the internet. And really, there is just a big need to reduce cost, improve access and outcomes, right? That's what we hope the goal of all of this is really to make the lives of our patients better. So again, one of the big things that's really driving this change forward is the Digital Health Act of 2023. Um, the goal that was outlined in this act is it's to accelerate universal health coverage via technology. It created an agency called the Digital Health Agency. That body then is going to be the one responsible for trying to get all these pieces in place, deploy them, whether it's track and trace, whether it's EMRs, whether it's CDS, clinical decision support. There's a bunch of technology that they're trying to roll out, and one of the big efforts that they're doing is launching this unified health information exchange. This is a digital place where people can put patient records and other practitioners, whether it's pharmacists, whether it's community health workers, whether it's providers, can access and share that information on there, really allowing, a patient to take their information with them and get care everywhere, which is really exciting for pharmacists. Um, they have a lot of data security pieces in this as well. So, anytime that we're talking about moving patient data, we really have to look at that privacy rules. And some of the other things that they're looking to do is standardize nationwide telemedicine, mobile health. Again, get, pharmacies connected to providers, get providers connected to insurances, really trying to move that network. One of their big goals to do this is something called the Digital Health Superhighway. And this is kind of their presentation for this. So as we see all these transformations happening, there's kind of a large framework going on behind the scenes to make this happen. You can see there's a lot of pieces over here on the right for point of care systems, Ken EMR, Tababu, some of these community health worker tablets or tools. All of that's going to kind of go into this National Health Information Exchange. And run a bunch of other services. So there's a shared health record. That's where you can get patient information from them. There's a terminology service that is something that allows all these systems to communicate together, kind of make sure we're all talking the same language. When someone has diabetes, how do you identify that that's what this other system's talking about? There's a bunch of registries for workers, facilities that are partnering with the regulatory boards. All that's going on in here. One thing that I noticed when we started looking at this, and Livia as well, is there really isn't a whole ton of call out for pharmacists directly. So we see, a lot of EMRs that's going to be providers, nursing, facilities on there. We don't see a lot of pharmacy directed stuff here. And so as part of Livia coming in and being in the digital health space and really having a focus, having a strong bed of pharmacists on our team, we wanted to see how we could start engaging pharmacists and bring them onto this digital health superhighway. We feel that pharmacists have a lot to offer. That as this change is happening in Kenya, bringing on pharmacists would bring a lot of benefit to the patients. So kind of what I want our presentation to focus on is, some of the stuff that Livia is doing, what it looks like to be a pharmacist on the digital health superhighway. And so we can kind of review what that change is going to look like for pharmacists in the future here in Kenya. So what does a digital pharmacist look like? It really is a kind of a big change in the shift of what maybe pharmacists have been doing. It's moving from a primary dispensing role to one that does a lot of clinical care. And you can use technology to aid in that clinical care. It's moving from a pharmacist who's maybe getting delayed information, like what they're going to be paid from an insurance for a dispense, maybe delayed information on what prescriptions are if they're coming across via paper scripts, to tools that are real-time decision making. Providing real-time feedback to pharmacists, supporting pharmacists in our work real-time. Another thing that a digital pharmacist looks like is moving from opaque inventory. We know we have all these drugs sitting on the shelf, which ones are expired, what ones might be recalled from PBB. Moving to something that is action-driven and intelligent technology to help us with that. Reports that are going to guide us and say, these are the drugs you need to go look at that they might be expired. These are the drugs that PBB says are recalled. How can you take them out? How can you ensure that you're not going to give those to patients? And then finally, this is going to move from a siloed pharmacist where, maybe in the community setting, you don't have a lot of connection to providers, to really moving pharmacists to a care team participant, that there's going to be disease management programs getting started that need to run adherence, and pharmacists are primed to deliver that adherence care, those medication reviews. That kind of chronic or medication therapy management stuff. So this digitization, this technology is really going to aid all of these changes. And now we can go through and just kind of show some of the pieces of technology that will start moving this stuff forward. So Livia, as a company, again, we're really focused on our pharmacist. What are we doing to digitize pharmacists? What are we doing to move these from all the roles on the left to the roles on the right? We'll just take you through some of the examples. And these are, implemented both in our software, but also across the digital health superhighway. Livia's pharmacy ecosystem really focuses on three core components. The first one is the National Product Catalog. This is built with PBB, so anytime that PBB registers a drug, Livia gets that information and we standardize that drug information. What is the generic? What is the route usually for this? What is the form of this medication? Is it a tablet? Is it an aerosol? Is it a powder that's reconstable for solution. We really standardize all that information and put it into a hierarchy that then can be used. So when a provider orders a med, they can order the generic, but that's linked to all the products that PBB has registered. This kind of national product catalog is the driving force for a lot of this technology change in pharmacy because it gives us a way to communicate with others and with computers what we mean when we're talking about a specific drug. Then we have a formulary management provider. This is a piece of software that insurance companies can use, and it allows real-time integration with pharmacists or even facilities on what drugs they would cover, what they wouldn't. That way you can get real-time feedback on, if I dispense this to a patient, how much would I get paid? Is the patient going to be covered for this? Hopefully will allow those payments to happen quicker in the future as well, that you're not waiting 90 days, 120 days to get those things. And then last but not least, what we're most interested about is our pharmacy information management system. This would be for community pharmacies. It's a platform that allows them to operate and run those community pharmacies with a lot of integrations into this digital health superhighway. Most of the rest of the slides here will be focusing on this PIMS. That's where a lot of the demos are. So we hope that it will get you excited for it. And again, the big thing is that we know that digital health superhighway is truly changing, how care is taking place in Kenya, and we want to bring pharmacists on board with that. So we want to release a technology platform that allows them and gets them engaged, and we hope that that's what our PIMS is doing. So I'm just going to kind of go through then and see how our PIMS is moving some of these care pieces from that left side to the right side. So we'll start off with dispensing to clinical care. We've kind of focused on a few areas. One is patient-centered care, right? Instead of just dispensing to a customer who walks in, we really want to put our patient and turn that customer into a patient at our pharmacies. For the clinical care, we can do things like alert and refill management, right? We can help manage their disease better. We can run alerts for this. So patient-centered care, we really have put patients at the center of our platform. So we have the option when you log in, you can create patient profiles. You can tie insurance to them. You can watch all of their prescriptions and refills tied to that patient's. You can look at observations, which would be like lab values that are sitting in the shared health record, things like hemoglobin A1Cs or their blood cell counts or their INRs, any value that's sitting in that shared health record. We can help retrieve it and display it to pharmacists, really connecting you to that patient and really putting that patient and all their health information at your fingertips so you can take care of them. Once we start doing things like this, getting a full patient history of their medications, allowing our pharmacists to see that, to go through them, to use that clinical training, we can further aid by building alert systems for our pharmacists, right? So now we're not just dispensing the medication, we're reviewing their whole history of their fills and seeing, is this going to interact with other medications? Is it duplicate therapies? Is this a pregnancy alert if you're a female at childbearing age? Is there alerts or warnings if you're an elderly patient on this? So we can really start running these things and give these tools to pharmacists through this technology to, again, move from that dispensing role to that really clinical care role that we know pharmacists are trained for. So here's an example of some alerts that could fire off in our system. We have thousands or tens of thousands of alerts. These are looking and would tie directly to the patient history. So you can see and go through, the system helping to highlight what is the issue, and then you as a pharmacist make the decision what would be the most appropriate choice there. This particular example here is looking at some duplicate therapies where maybe a patient is getting two ACEs at the same time, and we would need to cut one of them, right? We don't want this to be taken. It's probably going to lower their blood sugar and lead to some poor outcomes, maybe hospitalization. So here, a system that's really driving and bringing this to the forefront, allowing the pharmacist to say, there's something going on here. I need to make a decision. What therapy is appropriate for this patient, and helping them continue that while discontinuing maybe an older drug that they got prescribed, stuff like that. With that, then once we know we're making sure our patients are getting appropriate medications, making sure that they stay on them. So Livia is running a really detailed refill system where we can look at a particular patient, check the refills that they have that they need, highlight ones that are coming within a certain range, really plan how do we make sure we have the meds for them, how do we outreach to the patient to come and get their meds, how do we ensure that we're syncing those meds so that way, it's one delivery or the patient only has to come to the pharmacy one time to pick up their 5 meds that they need refilled. Livia is kind of building tools to really help engage pharmacists in that, critical component of disease management of refilling medications. We've deployed this in a few pharmacies. We're really looking how can we adapt this to fit the pharmacist workflow. So maybe it's, modifying it so pharmacists can look across filling a particular med, all the patients that would need that refilled, helping them with ordering that. Continuing to move our pharmacists from the old way to a digital pharmacist. How can we look at using technology to get real-time decision support instead of this delayed information that used to go on? We can support things like inline pharmacovigilance recalls. I'm sure a lot of the pharmacists on here have been to the PBB website on the recalls where you click in there, recalls, withdraws. They have that kind of basic looking table, and you go through and it says this lab and allied product might be recalled, and so then you have to go find it on your shelf, right? A very time consuming, hard process. I've spent a lot of time looking at that. So we can see and use technology to aid that, put it in line with our work so we're not taking those times out. Real-time insurance adjudication. So you're again getting that feedback. Is this going to be covered? How much am I going to get paid for this? Real time instead of waiting or submitting something by paper and then figuring out you're not going to get paid for it or waiting 120 days to get that payment. Automatic dose conversion is another one that we've heard a lot about where, say in the chemo space, where getting the dose correct is really big. How can we use tools and technology to support our pharmacists, right? Give them something that they can double check. This dose should be 5 mils instead of 200 milligrams. Looking at that and allowing the pharmacist to validate that instead of having to do that calculation themselves. What this looks like in a platform. So within our PMIS, this is, again, partnered with PBB. We pull that recall information and we package it into a way that can be delivered within your pharmacy systems. Again, really engaging with that, making sure our patients are getting good products. So you can see if you have inventory that there's a recall, like the screenshot on the left. You click into that recall and it will bring up the PBB listed information on that right in line with how you're working. So you don't have to go to that website. You don't have to remember it. The computer is going to match these things using, again, that national product catalog, PBB partnerships, delivering this stuff right to you as you're working on it. Real-time insurance adjudication. So within, a system, how can you, again, become more real-time in your decisions? Plugging in patient's insurance information, saving that on that patient profile. So again, we're providing care to the patient, not just an insurance member. We always want to try to push things to the patient. So here's an example screenshot of saving the insurance information to that patient. And then when you go to fill, that insurance is automatically pinged real time and providing feedback to you through formulary systems that, maybe the amount you're billing is more than the insurance is willing to cover. Maybe a copay is needed. Maybe a different brand of the medication is needed. Maybe the dose is too high for a pediatric patient. Whatever insurance rules they have that could deny you those claims, we want you to get that real-time feedback so you can feel comfortable dispensing it, knowing how that's going to look and how that's going to affect your business. And then again, automatic dose conversions, using that information that's in that national product catalog. How can we do things like get a prescription for etoposide where the doctor wants 170 milligrams, right? The patient comes in, their BSA is a certain amount. It calculates that they need 170 milligrams. If you select an inventory item, having that automatically calculated that you're going to need 8.5 mils to pull open this syringe. That's going to be 2 vials of this medication. How can we put these tools and embed them so pharmacists can use them, getting that real-time support in the work that they do. A big one for pharmacy is also managing inventory. So we have a clinical part, but also, a lot of the stuff we do deals with physical stock of drugs. So how do we move pharmacists and digitize them from an opaque inventory to something that's action-driven and intelligent, that's really providing feedback like you need to go look at these inventory things. We already seen recalls that can kind of do that, but there's a lot more that can be done to really digitize and help move pharmacists to this new level of work. Alternative product selection. So if a doctor orders a Topicide, there could be 30 or 40 different brands out there, each with their own unique name. So again, in partnership with PBB and the National Product Catalog, we've been able to integrate this and show you, like when a doctor orders a generic, here are all the brands that can be supplied for that. We can link that to your inventory. We can show you these are all the ones that you could dispense. To that, demand forecasting for inventory is another really big one. Looking at your history and seeing, across generics, how much Metformin 500 have you used? What brands of that have you used? Trying to suggest this is what you should order, this is what you should keep on your shelf. Again, really moving to that intelligent inventory tools versus the opaque stuff of trying to do this by hand or calculate it with other methods. Expired stock tracking. So we know products expire. Sometimes it can be tough to go through the shelves and look at them. So let's put that into inventory. Let's give tools to start suggesting, hey, you should go look at these products. They might be expiring soon on your shelf. Maybe you can return them back to the manufacturer. Maybe you should put them in quarantine them so they don't get dispensed to a patient. I know there was a recent news article where someone got some expired product in the OR, and it was kind of creating quite a fuss or a big news cycle story in Kenya. Intelligent inventory locations. So a lot of times the pharmacies have a bunch of shelves. How can we build systems that suggest where to put them, better placement for you, keep tracking of them so it's easy to go and find them, displaying that information to the pharmacist or the technician to easily go and grab those things. And then really wanted to move from siloed to care team participants. So pharmacists, again, definitely in the community, it might feel kind of siloed out there, very outside of the hospital systems, outside of the facilities doing their work, maybe not always connected to providers. How can we move that so pharmacists can be part of that care team? Things like patient verification is a really big one, right? That if a provider sends information to you on a patient, that you can verify that that's the right patient, that you have access to that data. Things like e-prescriptions, when a doctor's writing a prescription, instead of always sending them via paper scripts, moving them to an electronic method that you can get those in, that computers can understand, that they can check your inventory to make sure that you're able to dispense it, that you can go and find other methods or other brands that might supply this if a doctor wrote for a specific brand instead of a generic. So Livia is offering tools to help support this, things like biometric face recognition to help identify patients, OTP, biometric scanning. There's a big effort to do a lot of this verification to reduce fraud in the digital health superhighway. And Livia, we want to make sure that pharmacists can take advantage of all this work that's going on. E-prescriptions, this is kind of one that's behind the scenes, so there really isn't a great screenshot for it. But when a doctor or prescriber writes a prescription at one of the public facilities, and that goes up into the shared health record, and they weren't able to dispense it because maybe they didn't have stock. How do we get that to community pharmacies? How do we connect community pharmacies to that prescription to fill it for the patient? One of the worst things that we can do is get a doctor to write a prescription and then not have it be accessible for the patient. We think that community pharmacies can really fill those gaps. So after doing a patient verification, that prescription then can flow to your pharmacy, and you can just retrieve it electronically from them, already largely entered in. Dose adjustments, it can check your inventory, stuff like that. Again, making sure that these patients have access to these medications. So just kind of going back to, why we were showing all these things, some of the technology that's coming forward that's really digitizing and going to change how pharmacists practice. Again, moving from dispensing to clinical care, moving from delayed information to real-time clinical decision support, moving from opaque inventories to action-driven intelligent inventory systems, moving from siloed teams to care team participants. A lot of this is coming about because if you can connect as a pharmacist to payers, providers, and regulators, then you can become part of that care team instead of being siloed. If you're using some of that and changing how you practice from just dispensing to clinical care, you can drive safer medication decisions. If you're changing how we're doing inventory and you're using technology to monitor and track and suggest what needs to be done, how to manage your inventory better, we can, remove from or go from that opaque inventory practices to kind of real-time visibility and analytics into our inventory. And if we can move from being siloed as pharmacists into the care team, we can deliver better clinical and digital health services to our patients and better support those providers that we're connected to and the payers that we're connected to. So kind of a question that I want to end with is digitization is happening. You probably hear it all over the news cycles. So how, as a pharmacist, do you plan to become digitized? And with that, I think I can open it up to some questions.
Yeah, thank you. Thank you so much, Kent. That was quite comprehensive, and I know there's definitely questions just to keep up. So maybe opening the floor to the members and participants, feel free to share your questions in the Q&A tab. And I know our speaker is very present and able to respond to them. I have already noted there are 3 open questions at the moment. And just as we welcome more, I just want to invite Kent to try and address them. So I'll read them out for you, and then you can pick them up. So we have one question from an anonymous attendee asking, will this tool also be used for HIV and TB care? And then we have another anonymous attendee asking, what possible errors should be anticipated with such a tool? Then, of course, the third is from Patrick, and he's asking, how interconnected is the Livia app from one pharmacy to another or hospitals? Maybe for a start, you can address those 3 as we just request that the participants, if you have any questions, feel free to just type them in the Q&A tab. And if you'd like to ask verbally, there's an option on your window. Just raise your hand, then we'll give you the opportunity to speak. So Kent, let me, I don't know if you got those 3 correct. If you'd like to respond.
Yeah, definitely. I'll start off with the HIV question. Technology can really elevate the pharmacist in HIV care, right? Things like adherence are so critical to HIV and tuberculosis treatment. Things like guideline recommended care, so prescribing the right types of drugs at the right time, the right combo of drugs to target a patient's evolving HIV virus, right, to keep that viral load down. Those are all really important things. Monitoring labs and tying that back to the medications, right? Patient starts a new medication a few months later, being able to look at and see, is their viral load where we want it to be? Is it under control? All these things are really important for the care of a patient and something that pharmacists can help with. So we can see technology aiding this in a few ways. We've seen alerts, right? HIV medications are notorious for their genetic and CYP enzyme alerts. If you're on this HIV medication, you can't take these other 10 drugs because it's going to decrease the effectiveness of them. So delivering these alerts is a huge area where we can support pharmacists in providing that care. Other things that Livia is doing that we didn't show is treatment courses. So going through the guidelines of like NCCP and the chemo guidelines or HIV guidelines and writing out treatment courses that doctors can prescribe to, that pharmacists can review against, right? This patient should try these meds as first-line therapy, these meds as second-line therapy, or this dosing schedule where you're getting an order of your HIV med every month or these 3 HIV meds every month. Building those treatment plans is something that Livia is doing and will really elevate pharmacists by allowing us to get connected to those guidelines, to review against those guidelines with technology's assistance and help, delivering that information to you as you're taking care of these patients. And the last big thing is adherence. A refill management program and having the tools to do that, right? To look at all your HIV meds, to make sure that you have them stocked, to make sure that you're doing patient outreach a few days before the patient would run out of that med is really critical. So instead of having to do that maybe in Excel sheets or maybe on paper, let's build tools that are directly aimed at allowing pharmacists to do those refill programs, right? To look at all your HIV patients and say, these are the ones that need filling. These are the ones that I don't have the drug in stock beforehand, and get that organized and figured out. That way we can continue to ensure that patients are getting those medications. So there's a lot of stuff in the HIV realm and tuberculosis where technology, this digitization, is going to help elevate pharmacists practice better, take better care, alleviate some of the manual work that might be doing now to allow them to do that and really focus on that patient care versus some of the other paperwork stuff, versus some of the other clinical information stuff that maybe you have to go retrieve for some of the monitoring stuff like adherence. All right, so the next question that I got then of those three, so how do you kind of deal with errors of this? So I think the big thing to realize, anytime technology is rolling out is as an informaticist, there's kind of a fundamental theorem here that, technology, including AI, is not something that you ever really want to replace pharmacists with. Pharmacists have gone to school, they've practiced, right? They've worked with doctors. There's a bunch of soft skills that they picked up there, like how to interact with the patient, how to realize where a patient's struggling, how to work with doctors and get therapies changed, right? How to catch errors that maybe aren't so subtle that they're just glaringly obvious in a computer system or on paper. So what we really want to use is this technology to work with pharmacists, right? Pharmacists are very good at doing some of those other skills, some of that clinical knowledge. Computers aren't so great at that yet. Even with AI, there's still a lot of deficiencies like hallucination, stuff like that. So we really want this technology to be delivered in a way that, we have tools suggesting things, and we have pharmacists reviewing them for the accuracy, reviewing them for the context of the patient that maybe the computer gets wrong. So we want this to leverage and push pharmacists to a higher level, right? If we can show pharmacists using these alerts to provide better care, to reduce drug adverse events, to reduce some of these news stories that pop up of someone getting a med and interacting with another med and it causing issues. And then we can alleviate pharmacists of having to go through all that manually and allow them to start focusing, how do I make changes, right? If I see a patient's on two medications that are in the same class, what is the appropriate action? I think that's really how we handle errors, is knowing that there might be some that pop up. But again, there's errors that pop up all the time now without the technology. So how do we make it easier for pharmacists to identify those and act and correct them is a big important thing. And then the other one is integration, is the third question I got from that last set of three. Livia right now is well integrated. So we've primarily showed our PIM software. We do have a lot of other software. So we run some medical benefit management for universal health care. We have some telehealth components that are being deployed. So Livia, if you join on to Livia platform, you're going to be integrated to all those, right? We run the national product catalog that is going into every aspect that touches drugs. So it sits within PBB. We're using that to find products that are in country that aren't registered with PBB to help them get their WHO next level maturity for manufacturing status. I think it's level 3 that they're going for right now. We're integrated within track and trace systems and logistics management and wholesaler systems of, here's how systems can send these drugs and communicate to you how much they need, what's being used. Here's IDs for specific products that you can scan. Here's images that we can display to you so you can better identify drugs. We're integrated with all those things. So connecting in with Livia's platform gets you connected. From the community pharmacy standpoint, I would say that, Livia's PMS is integrated with all those other systems. There isn't a ton of integration with other pharmacy management systems at the moment. We're definitely open to that, and we have a lot of platforms that allow us to do that. But I think as we've seen kind of this digital health superhighway get created and really take off in the facility space, right? The hospital space, the clinic space, the community health worker space. Community pharmacy really hasn't been brought on board. And we noted that at Livia a long time ago. And that's why we kind of created this PIM system, why we've really pushed for a lot of these technologies to be integrated into those. We're really trying to get that on. That's something that we would love the PSK membership to help us promote is there's all these things happening at dispensaries and facilities and with different provider groups, oncology centers. How do we get community pharmacists into that? Right now, as such a valuable team member, they're kind of being left out. How do we get them onto the digital health superhighway? How do we get them connected so that we can work as a care team? They can be part of that. They can affect the care of the patient.
Kent, just following up on a couple of these other questions here. So there's a question in the Q&A about testing the tool, and does it have a downloadable option? So maybe clarify for the listeners what the system is and how it operates, so people can understand what they're getting here.
Yeah, so again, Livia has a lot of components that are going into this digitization. As Swat kind of mentioned earlier, we're not just focused on pharmacists, but we have a lot of pharmacists. We really do promote that. Right now, our big launch for the PMS, which is where most of the software that you've seen is sitting, is going to happen at the PSK annual conference in about a month. So there are options there. If you want to get hands-on early, I don't know, Swat, do we have a way that they can get in touch now? I think our website
Yeah, we're
has some
we're we
links.
will be communicating out different ways to gather interest of who's going to be interested, and there are early adopters that want to trial and things like that. For right now, we're in the process of developing some of those pieces, but that won't be a problem, I would imagine. So, um,
Yeah, so
and
I
more
think the
more is
best answer.
really, yeah, more is really coming out. We're really wanting to feature this as part of our PSK partnership and the launch there. So really wanting to make sure people have the opportunity to connect with us at the PSK meeting.
Yeah, and I think probably the biggest pitch there is again the best place to demo. Obviously, if you really are excited, and we love that you are, reach out. I think we can put our emails out here and some contact information. But at that PSK annual conference, we'll have a booth. Stop by the booth, get hands-on demos from our team members. If there's a particular area that you're interested in, like alerts, we'll have an expert there, a specialist there, a pharmacist. If you're really interested in inventory, some of the modules that you've seen around that. We'll have someone there that can be specialized and talk to you just on that. So it's really that booth will be a great opportunity to stop by and demo this product and learn more about it.
Kent, we have three questions that are kind of all in the same light. One person has asked, can the system be customized further? Same question. We currently have different and numerous systems. This being a new one, can it be customized with the systems we currently use in hospitals or chemists? And then another customization. So maybe shed some light on those questions.
Yeah. Our system is highly customizable. One, we are actively developing it. We've deployed it in a handful of pharmacies. We are deploying it within the digital health superhighway components of this, like the national product catalog. So we're always getting feedback. We're always looking for what's the next thing that we can tackle, what's the next problem that we can solve. So that is happening in real time, and a lot of that, comes at customization from someone first, and then we roll that feature out to everyone else. So we've had people ask about eTIMS, so we're starting down that process of getting eTIMS clarified and getting that put in here. We've had people ask about, you know, email and reports to like pharmacy owners or pharmacy administrators or managers on certain things like what is the inventory stock, what are sales for that day. So we've built tools that go into that. And you can get those reports emailed to you, right? And we'll usually roll them out as a custom option. Then we find that a lot of people have actually wanted this. They maybe just didn't think to ask. So we expand that to everyone. As far as integration with the other pharmacy systems, parts of our system are definitely going that way, right? National Product Catalog. This is an effort with PBB. They're looking to standardize how all systems communicate about drugs. So we have a lot of technology options to deliver that to these other systems. Livia also has a long track record. So we've been in Kenya doing kind of digital health stuff since 2016, so 10 years now. We've integrated with a lot of other insurances, smart platform stuff like that, right? So we have integrations with some of those other systems that might be out there, as well as like things like formulary management. We have open documentation. This might be a little more on the technical side. That if those other systems want and they want to get integrated, we have the tools to do that. We've built this infrastructure on a way that is meant to be integrated. Again, largely with those kind of requirements of the digital health superhighway be in there.
Next question here. Can PIMS be used in level 3B facilities what are some of the reports you can generate via PIMS, and then what does PPB advocate for when it comes to delivery of medicine to patient from pharmacy to homes?
Um, So level three facilities, we'd have to talk about that with how PIMS would look in there. There are components to our ecosystem that are probably already going into some of those level three facilities. Again, National Product Catalog being the big one. We're rolling that out with most of the private institutions, with some of the public institutions as well, certain counties there. That's all being integrated, right? Things like alerts can be pulled in, automatic dose conversion. Those tools can be supplemented into other systems very easy with the way that we've built them. We love that our PIMS, we think that it is built by a lot of pharmacists. We have a lot of pharmacist input, review. We love going to the pharmacies that have deployed it, asking what's the next feature you want. So we do think that it is probably the best on the market. So yeah, if there's a level three facility that has a need for it, we would love for you to reach out and we could talk about what that might look like. There was a second part to that question, Swat. I maybe missed it if you can repeat it.
Yeah, it said, what are some of the reports that can be generated in PIMS?
We have forecasting reports, expired inventory reports, there's sales reports, there's unpaid claims reports. Um, I can maybe put a little thing together, or we could always reach out. There are probably too many to do. We fire these alerts now, so we have, if you want to do alerts and do some of that clinical care, you can get reports on what providers are ordering drugs and what alerts do those providers run into, right? The list kind of go all the way down. Um, yeah. There's a lot of reports, and again, we're really open to customizing. We kind of have a reporting system. My background as an informaticist, I love looking at the data. How is it structured? How do we use that to drive action, to drive insight? So we kind of have a platform to build custom reports, and we can get out if there's things that are not missing. But again, really support reaching out after this presentation, reaching out to us at the demo booth at the PSK conference when we're there. If you have more interest in what reports are available, if you have thoughts on reports that are missing, take one of those two avenues, reach out, and we can probably provide a little more detail than I can off the top of my head, without screenshots, without being able to demo the product, and all those reports that we have.
Will patients have access to this? Say they want to access their medical histories. Also, it seems like hospital pharmacies will benefit most from this since the medical teams are within one institution. What about community pharmacies? Will they have access to these patient histories as well? And what would happen if a patient moves from one hospital to another? So it seems connectivity here to the patient history component, Kent, and then what is the interconnectivity with what's going on behind the scenes?
Yeah, so being easily accessible to doctors always makes pharmacists' lives a little easier, right? That interaction, that being able to raise clinical questions by walking down the hall, by making a quick phone call to someone that they realize, is super helpful. But that doesn't exclude the value of our community pharmacists. Community pharmacies are making clinical interventions. They're treating patients and taking care of patients every day, thousands of times a day, if not more. So our goal with PIMS is really to get pharmacists integrated. Right now, we've kind of done that with the e-prescription with formulary management, leveraging these tools to get data from the public hospitals, the private hospitals that are out there. We can kind of use formulary management as a way, as a tool to gather that data and then display it with pharmacists. So back in my presentation here, I don't know if I can actually go back. I kept on bringing up Atopicide, right? That Atopicide maybe doesn't have a lot of impact for community pharmacists. That was a tool that we use to get all the prescription information coming from these facilities into us, so we can look at their chemo, we can look at when they're getting metformin filled or prescribed, right? That can build these patient medication histories that then we can feed into alerts. So we are very in line with getting community pharmacies connected. Right now, we've had most success with doing so on the prescription medication history, right? getting all these providers to, when the prescriptions were in for a patient and sent, having it checked against a formulary system, that formulary system then storing that data and turning it into an e-prescription that can be retrieved by community pharmacists. Again, after patient verification, kind of patient consent that you can see their data, that can move to your pharmacy in the community. Then you can review all this, right? You can see that they filled and been paid for by Shaw, maybe as an insurance or other private insurances that we're partnered with, hopefully onboarding more, that they filled these things, other Livia members, and kind of direct them and help them. For the patient data, I would probably have to connect you to PARS at the end of this. We do have some patient apps so patients can review data. One of the big things that we're doing within the National Product Catalog is making medication identification easier. So we're working with manufacturers to get pictures of the boxes that their medications come in, that the tablets, what they look like. That way patients can use their cell phone and take pictures of a product, bring it up, understand it. We're working with manufacturers to get their patient package inserts, digitize them so they can be displayed within a patient phone app or something like that. So I don't know if we fully have all the patient connectivity figured out. Definitely a lot around how do we deliver the information in a way that they can digest and that they can answer some of their own questions, that they can become an active participant in their own care. Uh, we're still working through some of those, and we hope that as patients do that, as they become active participants in their own care, that then they would leverage pharmacists. Like maybe there's a place where they're uncomfortable, they don't quite have the knowledge that they want, right? Their pharmacist is hopefully the most accessible one to them. It's in their community. It's very easy. You don't necessarily have to make appointments all the time. That they could stop by and ask some of those questions, and really, again, using that to promote the profession of pharmacy.
Next question. I'm going to combine the next two because I think there's a little bit of overlap, but I think for you to give some context, Kent, and then I think we should provide very specifics on the following question. So, first question, the pharmacy profession is already infiltrated by non-professionals. What is the risk of these technologies used by others to practice like pharmacists? And then as a follow-up, what will happen if I trust the system and a medication error occurs? How do I go about any kind of legal action that may be undertaken? So if you want to answer on the first one, and I think we can provide some general context to the second one.
Yeah, I think to the first question that this technology is really going to enable our pharmacists to do more, not always as much the technicians. There's a bunch of clinical information stored in, like how do you resolve a drug error, right? What would be the most effective path forward after seeing an alert pop up that someone is on a medication or got prescribed a medication and they're pregnant and that medication interacts with that. Like that's where that alert stops. And that's where the pharmacist picks up and carries on forward from there. So they can't take lisinopril, probably not the best example, but the pregnant patient can't take lisinopril. That's where the alert stops. Then you need a pharmacist to step in and start saying, okay, well, what is an alternative blood pressure medication? What are we actually trying to treat with this patient? How do we reach out to the doctor and get that resolved? Uh, your technicians aren't going to be able to do that. This is really going to bring this issue to light to a pharmacist, and then that clinical training, those decisions, that clinical care, that participating as a team that probably only a pharmacist can do is really going to be able to step in and get that um, get that med changed, get that new interaction with the provider resolved, take better care of our patients, which is going to look great on the profession.
Great. And then I think to the question around the legal action here, I think that's probably more suited towards, any healthcare entity when a medication error occurs, right? There's always going to be a process, there's always going to be appropriate documentation that needs to be had. And I think one of the benefits that the PIM system has is that the process as you're going through and evaluating patients, there's going to be documentation that exists. There's going to be support on how things were done. At the end of the day, legal action is going to have to be managed according to whatever legal entities exist. But I think the idea here is, and Kent, maybe you can comment on this, right, about trusting the system and what that means as a user of the system.
Yeah, man, I think everyone can go Google like Kenya person gets expired medication in the OR. There was a story from early May about this and how he's
Hmm.
suing, and the lawsuit at the start seemed to be going pretty well in his favor. Um, having a tool as a pharmacist to identify and really bring to light those expired stock before they might be given to a patient. Obviously that would be a huge help to that legal liability. It would reduce it. So I think there's a lot of ways where this technology, will prevent errors that maybe are already occurring, that will give you better tools to stop those errors from happening, and decrease any legal liability you'd have there.
Next question, around kind of any biases or onboarding pharmacy tech. So we have a whole onboarding process for pharmacies. I think that's a whole team support piece that we can provide more information on as you guys share your interest in wanting to adopt the system. And then the next question, how far along is the process for track and trace?
So Livia is not the provider who's doing track and trace. We support a lot of the infrastructure that will allow it to run. So like National Product Catalog, getting what's called a GTIN, that's the barcode, that information tied to a product, that information available to any parties doing that. We do offer, although we didn't deploy it here, an SDK, so that's something that developers can use that we can put into our PIM system that allows scanning, that allow image capture of a product to fit into the track and trace module, the data that's being needed to require. As far as the question of how far track and trace is along, the components are being tested. Uh, there has not been a successful end-to-end example of that going through yet. So it's still quite a ways off, I'd say. There's also some components of certain manufacturers, not that they've been required, maybe don't have barcodes on their box. It's obviously a very critical part. So there's going to be some regulatory component that needs to happen, which is going to push that true rollout for a full track and trace. Definitely requirements to do track and trace down the road a little ways. But with that, like again, National Product Catalog, if you can get connected with that, it would be very good. Like we are getting data from certain manufacturers, definitely a lot of the global ones that are, meeting track and trace standards in other countries where they're putting barcodes, they're putting lots and all that expiration dating on there. We are getting some of that data. So if you're working with the pharmacy system, or you want to get part of that, adopt our PIMs, tell your pharmacy system to reach out and see if they want to get integrated with National Product Catalog. That way you can deliver all those barcodes to you. We can deliver ones where like, let's take a manufacturer, Pfizer or something has said, yeah, we've made these batches, we've sent them to Kenya, that goes through PBB. It comes into the Livia system through National Product Catalog, gets distributed to whoever needs it. That way you can say, hey, I scanned this product. This is serial number 001 for a COVID vaccine or whatever. Is that something that Pfizer has said they made, right? That stuff's already kind of possible. It's just not end to end ready yet. Hopefully.
Uh, Yeah, no, that was good. I'm going to combine two questions here that came from the same individual. So, does the software integrate with lab wards, stores, and cashier in a hospital setup? And in addition to that question, does it integrate outpatient care or consultation with other departments?
Um, Lab is, a lot of these things that we've already kind of talked about is a journey, right? So like just as I was describing a track and trace, there are components that are ready. There are benefits that can be achieved by implementing those components. The end to end might not fully be there. So lab is one of those. Lab, we're really integrated definitely within the digital health superhighway, the whole environment there, as well as Livia. How do we standardize how this lab information is reported, right? How do we standardize requests for labs? What's going on with how do you take, a lot of times people will produce PDFs and give them to a patient. How do you like digitize those PDFs, extract the lab values in a way that that systems can understand and you can display that information to pharmacists? So Livia has some AI tools that we're deploying across that environment. We have some terminology standards that are doing. Uh, for some private companies, where we're private insurance companies where we're working with labs to get paid. And some of those lab platforms, we have that data available for observations. Some lower level facilities that are running on certain platforms, we have integration with definitely around chemo and cancer at the moment. So looking at like what vitals do they have? What kind of lab values as far as, full blood counts, or liver function tests are they getting, really pulling those in, just because that's such a high critical area. That's where we've kind of started. But I don't think there's necessarily a full integration with all labs at the moment. Although again, just as we've been saying, if there's any platform that you're using right now, we would love to reach out to them. If we can get a customer asking for this, it's a little better than just Livia asking for the integration. If we can get customers asking for those integration, it's huge. There's a lot we can do because a lot of labs affect medications like INR is very direct, liver function tests and your chemos, right? That might change therapies for pharmaceuticals. Even the outcome measures like hemoglobin A1Cs for our diabetic patients, getting that information into our system, tying it back into this real-time decision support is really going to allow us to move from that delayed information to that real-time decision, better care of patients, and allow our pharmacists to take advantage of that. So I
Great.
do want to address one question here because I see this pulled up. So before, if there's more, so I'll let you answer. But there's a question: what about ADR reports?
Yeah.
The adverse drug reaction reports. We have become very good friends with the people at PBB, so we do have access, and we're working on integrating that into our PIMS. So instead of having to log into the PBB system, what we're working on is, you can log into your system, you can bring up a patient profile. Say a patient comes into the counter and says, "Hey, I took this medication and I broke out in hives everywhere, or it really made me feel sick and I started vomiting." Whatever it might be, that you can just open up the patient profile, go to that medication. We're working on putting a button in there that you can click. It would bring up then the ADR forms from PBB, pre-fill out what information it can, like who you are as the pharmacist, what the medication was in a way that PBB understands and would relate to. Having a list of options and that you can drop down for what the side effect or the adverse event might have been, and really putting that in line with your work instead of being a separate system, and tying it back to, these are the patients that it's going on. These are the inventory items. Like if you're doing inventory and you notice that maybe you have IV Tylenol and it's turned black, I know is one that kind of shows up a lot in the recalls that happen. That you can say, I just click this inventory item and it will pre-fill out a lot of that information. And then I'm just filling out a little bit of what prompted me to note that this was, a poor quality product that was an ADR. So we are working on that integration and hope to have it out very, very soon.
Great, Kent. We've got a few more questions, and we will try to, for any questions, if we happen to run out of time, we'll be happy to connect with you at the PSK conference, or feel free to send an inquiry to us, and we can provide that email here in the chat here shortly. We know that, next question, Kent. We know that with the advancement in, I think this was AI, in pharmaceutical practice, it's accompanied by numerous drawbacks like validation of system, data quality management, and model of interpretation. How is the PIM system set to address all of these?
There's a lot going on in AI at the moment. I think as a profession in almost anything, there's a lot of worry that comes from that as well, right? That AI might be a competitor in the future. It might push us to the side in some regards. Healthcare is no different than things in manufacturing or finance here. Um, I think, going back to what I was saying earlier, that, Livia's goal is that these tools, they're not good enough to practice on their own at the moment, and they won't be for a long time. They have issues like those that were mentioned in the question. That's why I just repeated. So how does Livia take advantage of them? How do we deploy our own models and tools that are customized to how our pharmacists practice in Kenya, to the ecosystem that pharmacists are practicing in Kenya, right? Some countries have moved on and have been doing e-prescriptions for a long time, so there isn't a lot of paper prescriptions going around. But we know that paper prescriptions come into Kenya quite a bit, or invoices come into your pharmacy, right, from your supplier on a paper form. So, can we deploy AI to help read those and automate your work in that fashion? Those are tools that we've worked on that have been deployed in our PIMS, not that we've showed them. We do have an AI kind of expert, Dennis. He will be at the conference. So I'd recommend talking to him if you have additional questions on that. But again, I think the big thing, just noting that AI is out there. There's a lot to do. There's a lot of issues with it. This is where pharmacists really need to step up as well. That these AIs are going to come out. There's going to be tech companies pushing them. Pharmacists can evaluate if they're working well, if they fit their needs, if they're doing things like hallucinating and support that better management of them.
Kent, some quick rapid fire questions. Probably don't have to get into the
But
details.
just before you go to rapid fire, this is a Dr. Amina. I'm also a pharmacist. I think when we look at AI, we believe the combination of those humans that will host AI to unlock their potential are the ones that are going to survive the trend versus the humans that are using AI just to replace. So I think being ahead of the curve and having conversations on influencing this around the profession, because this is a threat around the world, by the way, every time this conversation comes, but we fail to see what we as pharmacists or the human interaction with the patients, what we can do if we had efficiencies in our workflow. So look at AI or any of these tools as a way to empower and unlock the potential of the pharmacist versus the pharmacist being embedded in tasks that don't require their license. That's the danger of us not paying attention to how we embrace AI, how we host AI, and how it unlocks the potential for the professionals.
Thank you, Dr. Amina, for that insight. Next, real quick, Kent. So we've got a few that we can probably get through pretty quickly, just some quick answers. Does your system allow pharmacists to prescribe, particularly for minor ailments, and make payers and claim?
Yep, there is a prescription module within our system that the pharmacist could use. As far as how payers pay for that, that's going to be up to them. Again, there's a lot of pharmacists on this team, Dr. Amina, Dr. Swat, myself. So we love that that is a scope that the profession wants to get into. So we fully support that. And I think both within PIMS and our prescription modules there, tying that to patient care, maybe getting some of that lab data to show that, we're taking in the full medication, the full patient history to make these decisions to really provide excellent care. There's a part to what can pharmacists prescribe and what are payers willing to do. And Livia has a formulary management side that's working with payers to negotiate that, right? Things like an example of this would be, SHA is paying provider, and they use something called a SHA code to when a provider does something like runs an A1C test. There's a very specific code that the provider bills, and that's what tells SHA how to pay, when to pay, what limits that might have. We're working with SHA to get pharmacist specific codes, so like MTM, maybe pharmacist prescribing codes. That way they can do that. Now, this is something that Livia is doing. We're trying to justify with analytics. We're trying to do that, but as PSK and as a pharmacist on there, start trying to raise your voice and lobby for that stuff too, and try to position and argue that pharmacists can make an impact here. It'll give us at Livia a lot of benefit to have that support, to have that stuff that we can go back to.
Is the system interoperable with the existing EMRs in the country?
Yep. So again, going back to I don't know about every EMR in the country, but all the ones that are getting onboarded, both private and public, in the digital health superhighway, we are connected to them. We're getting data. We're getting those e-prescriptions from them. We're running some of the formulary stuff through there, which is a method that allows us to get some of that data and share it with pharmacies and do some of that shared decision making, right? That would allow something like a pharmacist to receive a prescription through that formulary system. Since the HIMS are already connected, the EMRs are already connected to that. Pharmacy receives a prescription. The pharmacist noticed something off about it. The dose seems like maybe it was mistyped, right? Maybe there was a few extra zeros added. The pharmacist could then raise that prescription back into the digital health superhighway. And the doctor could look at it and say, hey, this dose looks like it's 10 times what it should be. Maybe a zero was added. Did you mean 17 milligrams or 20 milligrams instead of 200? That can go back to the digital health superhighway. It's integrated with those EMRs. The doctor can get that data back, respond back with a new prescription. So we're looking at how do you build those connections and really leveraging both our PIM system to get pharmacists like a user interface for that digital health superhighway, and then some of the other infrastructure, national product catalog, formulary management provider that allow us to kind of facilitate those interactions with all those other systems, with SHA's system, right? So the short answer there is yes, we are integrated with a lot of the EMRs, not all of them. And then, really focusing on that prescription aspect to start, hopefully moving into other aspects like labs. We're slowly getting onboarded with them, very unique cases where we are like chemo centers and stuff, but slowly we're trying to get more of that data and then figuring out, how do we share that with the pharmacists that are on our PIMS in the community or other facilities.
Is the drug information on the platform updated automatically?
Yes and no. There's a lot of information in there that does. So like manufacturers that have track and trace elements like the barcodes, that comes to us through PBB that can be updated automatically. The recalls that are put into PBB, right? We go work with PBB to get that data, and any updated recalls that they have every day, that system is pushed to us automatically. New drugs that PBB registers. So say a new manufacturer comes to market and wants to produce another metformin, that data comes to us automatically. There are other aspects like alerts where we have a team of pharmacists and clinical people that are reviewing and mapping those, right? That this is a new drug alert that came out in research. We've seen that other drug compendiums around the world have added them, or some of those public institutions have said this is an alert. Like, how do we actually integrate that in? That takes a little bit more review and care, so it's not an automated process there. Getting package inserts and kind of digitizing them so it's not just a sheet of paper, but taking that PDF and putting it to something that has headers that can be displayed on a phone, really nice for patients or for pharmacists within the app. Taking those care guidelines, getting those things in, like the essential medicine list, the Kenya National Formulary. How do we digest those? How do we make those displayable to people? That stuff that's not automated. It's something that we're manually doing, but we have a team of review people and a team of data people entering it. So yeah, some is, some isn't is probably the best answer there.
So real quick, there's just a couple of comments that I wanted to bring up. That Livia PIMS is also a fully functional POS system to manage daily sales at the pharmacy, that we are a DHA certified system. And then there was the last question here, Kent, was around eTIMS. Just any updates on eTIMS?
We are very, very far down the eTIMS process. We've gone through and got approval at a lot of the technical requirements, a lot of the documentation requirements. It is integrated. We do have UAT platforms or different ways to view what our eTIMS would look like, both for making sales of drugs, as well as clinical services. So eTIMS, that a pharmacist can do a clinical service and document that and do the eTIMS portion of that as well. We are waiting final kind of approval from KRA, but we're hoping to get that soon. And then once that is, we will fully roll that out within our system. But
All right. Well,
there's
thank you
always
guys for all of the questions. I know that there may be some that we might have missed. Some folks may have had questions. Please feel free to reach out to us. Again, probably one of the best opportunities. We will have a full booth, as Kent mentioned, at the PSK conference with many of our other team member experts that will be there. And we'll be happy to answer any questions there. Just for respect for everyone's time, we will turn it over back to Sylvanus to wrap us up.
And real quick, and those who've shown interest to get involved behind the scenes with Livia, please shoot us an email too, because that's something we couldn't address here. It wasn't a particular question, but those who will be interested. And we hope to see most of you, or if not everyone, in Mombasa very soon.
Yeah, thank you. Thank you so much, Dr. Mina. Thank you so much, Kent, Swat, and everybody else for engaging actively. This is very informative, and as from the reactions, it's very evident that the members and the participants are interested in this platform. So again, just an opportunity to further the conversation. We have another webinar with Livia, a pre-conference webinar on June 18th. So another opportunity to engage, with members of PSK and answer more questions. And I also appreciate the fact that the line has been put open for those who would like to engage directly with Livia at this point in time. Feel free to reach out to us. We will connect you and, of course, give you the support needed. I want to invite Dr. Sami Masibo to just give a remark. Dr. Sami is our treasurer at the Pharmaceutical Society of Kenya, and then I will wrap up the session in the next few. We should be done in 10 minutes. Thank you so much. Dr. Masibo? you, Dr. Manyala and Kent. I think that's a very wonderful presentation. It's one of the timely things. I think everybody right now is talking about digitization and whatnot. I am quite familiar with the Livia system, and I think every time I see a presentation on it, there's something that has improved. I think just one standing out thing that a lot of online pharmacies have been struggling with. So in my current line of work, I do a lot of assessments of online pharmacies. And I think one thing that I saw you guys have done is just the product registration status. It looks like a simple thing, but it's one of those things that can easily influence patient safety when people consume drugs that either the PPB has already flagged them or they're not registered for consumption in Kenya. It could easily lead to a lot of adverse reactions. So I'm really glad that someone is already thinking about it and it's already active in your system. So I just wanted to say congratulations to that. Of course, also reminding people that Livia is also our title sponsor for the conference, and reminding you as you come to the conference to engage with Livia to understand what they're trying to do, and we'll have a lot of interactions with them. For those of you who might want more information, our webinar is very congested in terms of the time, and some of us who like interacting with the system live, I think we'll have another opportunity in Mombasa to just interact with Kent and the team at Livia and try to understand how they're trying to move the profession in terms of digitization. So thank you so much, Manyala. Very well run webinar, and thank you everybody for attending. Back to you. Thank you.
Yes, thank you so much, Dr. Masibo. And just as a closing, segment, I wanted to jump on the bandwagon with a brief announcement with regards to the conference. Remember, we are doing our late bird registration, and this closes on the 31st of this month. After which we will now be looking forward to see you at the conference. But even then, the period between June 1st and 26th, the rates that are applicable would be the on-site rates. So if you'd like to take advantage of the slightly lower rates at this point in time, please register before the end of the month. And the registration is pretty simple by your members portal. You just need to log in, and you'd be able to see a public event on the left side of your screen if you're using a desktop. For members, it's pretty easy. You just need to search your registration number. But for non-members, you'll have to, again, select a non-member category, and then it will give you the correct applicable ticket. We have a quick engagement, again, at the end of the month with the Young Pharmacists group. So there's an invitation to you to join and support. And of course, progressively, we want to build a database to understand more about your needs as members. And we have our ongoing campaign that we refer to as Know Your Member campaign. This is circulated regularly in the forums. So when you get to see it, kindly support in completing it. Then as of yesterday, the National Treasury has invited stakeholders to participate in a national sustainable public procurement market readiness assessment, again, with a deadline of Thursday, 4th June. So feel free to participate in this and submit your views and opinions with regards to what is relevant to the sector. And then, of course, something else that we are doing to just ensure the membership has opportunities for capacity building is the project management professional certification with the June intake coming. And then, of course, the certified associate in project management certification as well. And then for those in the room who would like to come in different capacities to support, either as exhibitors or sponsors, again, we have other opportunities beyond the standard packages, and we invite you to engage with us and interact. Again, it's just another opportunity to access a pool of pharmacists and an opportunity for you to again, just engage and create awareness for the works that we do. Other than that, my appreciation and acknowledgement for your time this evening. We invite you to our next webinar series, and as mentioned, we have another session with Livia Health on June 18th, and we look forward to having you on board. Thank you so much, the Livia team. Thank you so much, Kent, for a very robust presentation. Thank you so much, Dr. Masibo, for joining us tonight, and everybody for creating time. Good night and goodbye.